Welcome to a conversation with world-renowned Beverly Hills plastic surgeon Dr. Richard W. Fleming. Today's topic is facelift techniques. Dr. Fleming, what is a facelift?
What we're trying to do with a facelift is improve the appearance of the lower two-thirds of the face and reverse the physical signs of the aging process. That is to say, relaxed skin, decreased muscle tone, and the redistribution of fat. Facelift is a very generic term. What is a facelift? Because there are very many different techniques which we use depending upon the needs of each individual patient. Our goal is a rested, vibrant, normal appearance without that pulled, stretched look. Not too many years ago, all we did was elevate and remove the extra skin. That has all changed now that we appreciate the fact that aging occurs at all different levels of the face, all different depths. It's not just the skin. As we mentioned, it's the underlying muscle, it's the underlying distribution of fat. So we vary our techniques depending upon the needs to address each of those individual layers. When we get relaxed muscles, that causes that turkey gobbler appearance that we see under the neck. Fat redistribution, we have a more hollow look in the face. We lose that youthful, nice, full face. It's more hollow, more drawn. We can actually get an accumulation of fat under the chin and along the jawline in the neck. So we can lose fat in some locations and accumulate fat in others. So we must address all of these layers when doing the facelift. You're fighting gravity and the redistribution of these tissues. A great many of the techniques today involve work on the platysma muscle, which is that thin muscle on the side of the face and the neck. By elevating the skin and then lifting and tightening this muscle, we can get a more youthful appearance. Most important with all of these techniques is the approach. How do we make the incisions? To approach the neck, the area under the chin, we can make an incision right in the crease, right in front of the chin, right below the chin. The incisions around the ear are very critical in terms of camouflage and what is accomplished. We make the incision within this tuft of hair that occurs in a woman or in a sideburn in a man. We don't want to change hair distribution because that can cause tremendous styling problems for the lady. Then in front of the ear, we don't make the incision actually in front of the ear. We make the incision on the ear, actually up on the ear. And here at the ear canal, we're in the ear. So it's hidden behind this cartilage. We then proceed down in that crease in front of the earlobe, up on the back surface of the ear, and then into the hair behind the ear or down the hairline behind the ear. We avoid, whenever possible, making an incision in front of the ear because even if that's a fine line, it will be seen after surgery. We want to avoid or at least minimize all physical evidence of the surgery. We don't want to put the patient in a position that they have to style their hair meticulously to hide their previous work. We want to avoid or at least minimize all physical evidence of the surgery, regardless of the age of the patient, the extent of their facial aging. There is a technique available that we can improve them no matter what their goals are and what they want to achieve. There's different philosophies about when to do this work and how much should be done at that time. There's a trend today to do smaller procedures at a younger age when a patient first starts showing the physical signs of the aging process. Certainly we're not doing facelifts on people in their 20s. But to do it at a younger age and to maintain it, there is a distinct advantage because they look better, they can enjoy it throughout life rather than waiting until significant or severe aging has taken place. Most people choose to do it at a younger age compared to, say, 20 years ago.